This video demonstrates an extremely accurate technique for pediatric central venous line placement. It is one of many techniques and has its limitations, especially in very small neonates. The concept is to follow the dot while making incremental advancements with the needle and probe. There is a lower chance of piercing the posterior wall of the vessel and a higher chance of correct placement of the wire within the lumen. As the needle begins to tent the skin, locate the anterior border of the internal jugular vein. It is critical to identify the tip of the needle prior to entering the vessel. Move the ultrasound probe in a cephalad and caudad direction and observe the striations of multiple horizontal lines. Once the tip of the needle is identified as a bright echogenic dot, begin to advance the needle a millimeter at a time. When the dot disappears, move the probe again to locate the tip. Once the tip is inside the lumen, lower the angle of the needle and then slowly advance. Continue to locate the dot. Make small moves with the needle and then the probe. Use the ultrasound probe in an up and down motion and maintain as flat an angle as possible with the needle. One of the advantages of this technique is that it is often possible to avoid piercing the posterior wall of the vessel. While this may not always be possible, especially in extremely small neonates, the decision to use a through-and-through technique can at least be a conscious one. Here you will see the entire 22-gauge angiocatheter fully inserted to its hub. In this example, no syringe attachment was needed. If syringe attachment and aspiration is required, this catheter position makes it less likely to dislodge from the lumen from small movements. Once the guide wire is in place the ultrasound probe back in position and scan the vessel in the transverse view, looking for the echogenic dot. Now use the ultrasound probe again in the sagittal view and look at the entire length of the wire.